Hi there, I'm Dr. Jessica Zuba, pediatrician and co-founder at Be Well Pediatrics in Austin, Texas, and welcome to our brand new baby course. If you're watching this, you're probably expecting a new baby, so congratulations. In this video series, we're going to talk about what to expect with new baby. I know a lot of times new parents aren't sure what to expect. They feel like they might not know what to do. So hopefully this video series helps take some of that pressure off and makes things seem a little bit easier. All right, so in today's class, we're going to talk about the first days in the hospital. So what to bring with you to the hospital, what to expect in the first couple of nights with baby, and what to expect when bringing baby home. All right, your hospital packing list. So there's 2 nice to haves on this list and 1 must have, right? So you know you're going to want to take pictures, so finding a cute Instagram-worthy outfit might be worth your while to snap those photos for your family album and to share with your friends and family. Swaddle blanket is going to come in really handy for those first couple of months, so having one of those is really nice too, but really your only have to have is a car seat. So I recommend, beginning the 3rd trimester, start picking one out, getting one so you are ready to go in case there are any surprises or anything happens early. And don't worry about the rest of the stuff. The hospital will have what you need. They'll have diapers, they'll have wipes, they'll have diaper ointment, onesies, all the things. So don't worry about stuffing that diaper bag. Just bring your car seat. All right, so baby is here, arrived, everyone is happy and joyful and exhausted. So those first 24 hours, make sure that you get some rest and you recover and feed the baby. That's really it for the first 24 hours. Those few moments when baby's going to be awake and alert, that's a good time to try to feed baby, especially if you plan on breastfeeding. That's a good time to work on latching, but mostly want you resting. Baby's going to be busy too the first 24 hours. Lots of screenings done for babies in the hospital, including a newborn screen, which that is a little hill poke that screens for, in Texas, 40 to 50 different genetic and metabolic disorders, including cystic fibrosis, low thyroid problems, and a whole bunch of other stuff. So baby will get one when they're first born, and also again one at 2 weeks. That's just how we do it in Texas. So some states will just do 1 at 7 weeks, but in Texas you get 2. Other screening tests your baby might get, or will get, is a hearing test, and it's something called a congenital cardiac screening, which is basically where they check pulse ox in different limbs of the baby to make sure their oxygen is great in all those places, and there's no concern for hypoxia or cyanotic heart disease. Another thing that's really important for a baby in those first 24 hours that's not really a screening, but really important and life-saving is vitamin K, right? So vitamin K helps prevent hemorrhagic disease of the newborn or intracranial bleeding or bleeding in the brain, right? Pretty scary stuff, but easy to prevent. So make sure you get your vitamin K. And if you're having baby at a birthing center, please make sure they offer these screenings and they offer the vitamin K. And if they don't, please ask them for a list of places where those things can be done. All right. So moving on, the second night, hopefully night 1, you got a lot of rest because now you're not really going to. Baby's going to be awake a lot more and cluster feeding, wanting to feed every 10 to 30 minutes. And that is normal. And that is an awesome design by nature, because the more baby latches and sucks and nurses, the more milk mom's body will make. So that sends a hormonal message to mom's body to be like, hey, we need to get our milk supply up and feed this baby, right? So just know that the more that baby latches and feeds, the more milk your body is going to make. And it may take a couple of days for your body to, produce enough milk for baby, and that is okay, and that's normal, and that's expected. Nature also has a plan for this. So babies are born with extra water weight on them because they're not going to be eating a whole lot in those first few days, and nature doesn't want baby to get dehydrated. So you might notice that as weight loss, which is totally normal in the first couple of days. Newborns can lose anywhere from 5 to 10% of their birth weight, and that is totally normal. So if you notice your baby's losing weight, please don't feel like you've done anything wrong. It's super, super normal. All right. And then last thing we're going to talk about is taking baby home. Big thing you want to make sure that we're practicing is safe sleep. So safe sleep is super boring sleep. You don't want anything in the bed with baby, no blankets, no pillows, no stuffed animals. All those increase the risk of SIDS or sudden infant death. And you want baby on their own surface, whether that's a crib, a bassinet, or one of those cute little European drawers that they have for babies. Look it up, it's a thing and it's safe. And yeah, so own sleep surface, no blankets, no pillows, no stuffed animals. Good rule of thumb for dressing baby for bed: if you're comfortable temperature-wise in a room, baby will likely need one extra layer, so just keep that in mind. It's certainly okay to swaddle baby as long as that swaddle is nice and tight and baby cannot roll over. So keep those sleep tips in mind. And then lastly, when to see your pediatrician. So babies usually see their doctor or their pediatrician after they leave the hospital in 1 to 2 days. So that first visit, again, the big thing we're checking is weight, making sure there's not too much weight loss. We're also, again, checking heart and lungs, eyes, making sure the umbilical site's healing well. Lots of things happening at that visit. And here at BeWell, for our families, we just ask that they call to schedule an appointment once they know they're getting discharged from the hospital, and we have same-day appointments reserved for those patients. So easy peasy getting an appointment. So there you go, our first video in the brand new baby series. Hope you find it helpful. If you did, please share it with your friends. See you next time.